Aromatherapy by Linda Knight, Jennifer Hull, and Erin Miracle. Aromatherapy is the use of essential oils from plants for healing. These essential oils are concentrated extracts taken from many parts of the plant, such as the roots, leaves, seeds, or flower blossoms of the plant. Aromatherapy is approximately 6,000 years old and has been used by the Chinese, Indians, Egyptians, Greeks, and Romans. Typically, it's used for perfumes, drugs. It can be used for spiritual ceremonies, therapeutic reasons, or hygienic reasons. During the 3rd dynasty BC, Egyptians tended to use these oils for mummification, while 18th and 25th century dynasty Egyptians refined the oils for use in medicine, cosmetics, and perfumes as well. A Greek physician by the name of Asclepius combined the use of herbs and surgery during 1200 BC. A world-renowned Persian physician named Avicenna invented a distillation process that allowed people to distill the essential oils from floral waters, while a French chemist by the name of René Gattefossé became focused on the medicinal use of aromatic oils when he accidentally burned his arm and then plunged it into lavender oil. He noticed that the burn healed fairly quickly, which then sparked his research into the healing properties and other powers of essential oils. He is generally credited as the father of modern aromatherapy. Furthermore, a branch of aromatherapy, Ayurveda, has been practiced for more than 3,000 years in Tibet and India, and is a traditional Indian medicine that incorporates aromatic massage into its processes. This is just a basic list of types of scents and what they can be used for. Aromatherapy has many uses in both human and animal medicine. Current uses in veterinary medicine include pain management, use during pain management, therapies, anti-anxiety medications. There are definitely different oils that can be used for different reasons. The oils have to be diluted or used in a diffuser so they're not too strong. Some oils can cause asthmatic responses. The scents can be incredibly strong for animals who have more sensitive senses of smell than we do. Oils have to be diluted to the fact that they are steam distilled typically from whole flowers and other plants and are incredibly strong on their own. Undiluted, they can aggravate respiratory problems, and essential oils used in aromatherapy are typically diluted with other oils, such as almond oil, jojoba oil, and sesame oil. We will just cover a few in more detail in this presentation. However, it would be important to note a few key terms. Fennel is used in the increased production of mother's milk. A vulnerary is an herb that is used in the healing of wounds, and a carminative is an herb or an oil that is used to prevent the formation of gas, assist in the expelling of gas in the GI tract. One that's used on a regular basis is lavender to induce relaxation. It's recommended, Dr. Allred recommends as well that it could be used in an undiluted form around the litter boxes of cats that have had a history of feline lower urinary tract disease. The theory is that it would decrease any stress associated with the litter box that may have been caused by pain in the past. Another oil Dr. Allred commonly uses is melaleuca or tea tree oil. She typically uses a dilute form to treat ringworm in dogs. It's very safe for humans. The oil can be considered contraindicated for use in veterinary medicine, so it's important if you are using it to watch for signs of oil toxicity such as central nervous system depression, paresis, and ataxia. Lemon balm is also commonly used. It has many different uses. It can be used as an antihistamine, an antibacterial, an antidepressive, an antispasmodic, and even an antihypertensive agent. It does cause drowsiness and can cause extreme drowsiness in combination with surgical drugs. So it is recommended if an animal is using lemon balm and will be undergoing surgery that they stop the lemon balm for at least 2 weeks prior to the usage of the drugs. It may also cause vomiting and nausea if taken orally. Information that can be found on the internet about aromatherapy. So we figured we would address a couple of those myths right here. There's a ton of information out there that will tell you that frankincense cures cancer. It is a compound within the resin of frankincense that currently is under study for anti-cancer effects. However, to researchers' best knowledge, the distillation process that turns it into an oil actually removes the compound from the oil. There are currently nothing that supports that any essential oils have any sort of cancer treatment effects, and in high enough doses, many of them can be carcinogens. Some people will tell you that essential oils are natural laxatives, that you can just give an animal a few drops or take a few drops yourself and it will clear you right out. Since many of these oils are dangerous to ingest, it is highly contraindicated to eat them. Many of them are also potent degreasers and can attack the mucous membrane lining in the throat, stomach, and intestines, much as in the same manner as drinking a sink degreaser like Drano can. There's a theory out there that if you're applying an oil directly to the skin and you see a rash or a burn, that's just a sign that the body is expelling the toxins with the help of that oil through that application site. Very, very wrong. If you apply oil directly to the skin, it can cause a rash or burn. Animals or people can be hypersensitive to this. Under no circumstances should you consider a rash or a burn or anything that could be considered an adverse reaction a good thing. The oils can have harsh topical properties. Dogs and especially cats can be sensitive to the ingredients in them and react badly. If you notice a rash or a burn, immediately stop use and contact your vet. Wash off any of the remaining oil carefully using cool water and a gentle soap such as Dawn. Smells can't harm my animals, so I don't need to dilute the oils. This is a common misunderstanding. Essential oils are usually in highly concentrated forms. And because animals have a much stronger sense of smell than we do, stronger smells can be detrimental in smaller amounts. Cats and birds specifically have a much more sensitive respiratory tract, and in birds, some scents can be fatal. Melaleuca, peppermint, and other oils in very strong concentrations can also cause asthmatic responses in cats. Another common myth is that these oils are all natural, they last forever. So you can use an oil you bought no matter how long you've owned it. This is actually very, very not true. Oils will degrade over time. Because they are all natural, they don't typically have any preservatives, even natural preservatives, that are going to cause them to last longer. Always follow the recommended dates that are on your oils. Store them in amber bottles in cool areas away from direct sunlight. Never use an essential oil that is past its due date. Just like any veterinary treatment, aromatherapy can be used with confidence and benefit to your pet. But just like giving them a medication, it should be done under the supervision of a licensed veterinarian. If you have any questions or concerns about your pet or how they may be reacting to an oil or therapy session, you should certainly bring them up with a veterinarian.